Good afternoon, this is Dr. Do again. This video is on the problem, alphabetic list problem today on B. Today's topic is going to, it's called blepharitis. What is blepharitis? It's the inflammation of eyelids. Before we talk about the problem, and let's talk about what kind of problem in the eyes related to the blepharitis. You need to go to the emergency room. If your eye pain, severely pain, especially you feel like throbbing pain, either from outside or inside, or surrounding area, the orbital area, I feel very, very painful, especially for the throbbing pain, and red or bleeding, or if associated with other symptoms like vision blurred, or seeing something like the curtain falling off, you cannot see clearly, and generalized symptoms like severe fever, headache associated with eye pains, very severe tearing, and photophobia means afraid of light. So this kind of situation, if occurred, I recommend you go to the emergency room or call your eye doctor right away, and visit your eye doctor as soon as possible. Okay, now let's talk about the blepharitis. Before we talk about the disease, let's briefly talk about the structure of eyes. We already talked about so many times, but today just focus on the eyelid. Eyelid there's some, of course, skin, subcutaneous tissue, some muscles, and some glands. Those glands, meibomian gland. It's what it's called, meibomian gland, just like our sebaceous gland in the skin. So component majorly are the oily structure, oily chemicals. And the purpose for those glands, like I said previously, to secrete the oil coating on the surface of the eye to prevent the water evaporated out, so to prevent the dry eyes. Those glands component of the oil, lipids, different components, and different people has different component of the lipids. Some of them are easy to be liquefied, just like compared to the vegetable oil and the animal lard. So one is very, no matter what you do, at room temperature is liquid form. And some people has like the form like lard. I'm not saying, this is just a parables, okay? So no matter what you do, no matter what the component is, those kind of lipid is kind of thick and could be solid at room temperature. So that's the difference from individually the component of the meibomian gland. So that's the problem. Start from there. For those tend to have solid form lipid. I'm not using the chemical name because this is just to explain to you. And then it's tend to clot those glands. Those glands have a small duct. So it's when it's blocked, then you feel something. You feel like foreign body sensation. And it could be something else, like the sty or chilizing, something swelling up, inflamed or not inflamed. That's just the one individual gland swelling up. But in general, if the eyelid, many of those small glands tends to block it and inflamed, that's the blepharitis. So, what kind of symptoms for the blepharitis? You feel like something, your eyelid may not swelling, just feel dry, itchy, foreign body sensation, like grit, something there to grounding your surface of your eyes. Not comfortable. Some people might have tearing associated with this sensation, foreign body sensation, or you can see it. It's getting flaked, red. You feel something is there all the time. That's really not comfortable. especially for those people tend to have the facial acne around the nose, or rosacea, that's the word. Those kind of people tend to have the blepharitis. And those people use cosmetics frequently to work on your eyelash and to block those glands, or inheritance. Just the people have the different component of the lipid. Some of them tend to be solidified, some of them tend to be liquid form, or the eyelash are thick and thick, multiple levels, and very thick and long. Those people tend to have the blepharitis. Okay, how to treat? Regardless, if you have this long-term going on, foreign body sensation, itching, no matter what you do, you're not comfortable, especially if you see the flakes and some crusting around your eyelash, I recommend you to see your doctor to make sure nothing serious going on, because the parasites or the serious bacterial infection could happen. And if after you see a physician and you were treated, and or they told you it's just a simple blepharitis, give you the antibiotics ointment, you can treat it by yourself, or you can get some over-counter antibiotic drops. It's available, not many, but it's available. So when to call your physician, like I said, if you long-term going on, itchy, dry, foreign body sensation, sometimes associated with the flakes and photophobia, and if it's 1 day, 2 days, went away, it's okay. By 1 month, 2 months, especially in winter time or summertime, very hot or very cold, you still have that feeling for lasting long time, then I recommend you to call your physician, or you can try at home, buy some antibiotic ointment or drops to see. If it does not work, go see your eye doctor or your physician to get treated. So this is very simple, but actually it's bothering people every day in daily life. We saw those kind of patients in the clinic. Just no matter what you do, it's always there unless you use the antibiotics to treat it. There's a special scenario, like I said, if one of the gland blocked, so it's going to be something grow there at the style. Does not bother you, but cosmetically doesn't look good because something's there. It's like a little bump. And if that structure is inflamed, then you feel very uncomfortable. The cleansing, if that's the case, it's called cleansing, then you need to see your doctor to take it out. So this is the very basic information about the blepharitis. It is very common, associated with dry eyes and other like stye or cleansing. So this is the very common, especially for those people with the rosacea around the nose, or long, thick eyelashes, or associated with other problem, hypolipidemia. That's the systemic disease associated with this, because the lipid, that's the major component for the meibomian gland. Alright, so I hope this helps you. If you feel foreign body sensation, gritty and also itchy and all the time, is not allergy season, either late winter or hot summer, is not allergy, but this could be the blepharitis. So go check it out, or have some drops to treat at home. And don't forget those warning signs to visit the emergency. At the beginning of this video I mentioned. Okay, so that is for this video, and thank you for watching, and I will see you next time.